Let me ask you something. When you think about your liver, what do you picture? You probably picture someone who drinks heavily, someone with jaundice, that yellowing of the skin and eyes. Maybe someone in a hospital bed in really serious trouble, am I right? Here's the problem with that image. It is the end stage. It is what happens after years of silent damage that nobody caught, nobody noticed, and nobody acted on. Because the truth about your liver, and this is what I see constantly in clinical practice, is that liver disease is almost completely silent for most of its course. By the time the dramatic symptoms appear, the damage is already very serious. I have been practicing medicine for over a decade. I have reviewed thousands of patient cases, and I can tell you with complete confidence that fatty liver disease alone now affects roughly 1 in 3 adults worldwide. 1 in 3. The vast majority of them have no idea, not because they are not paying attention, but because the signs are subtle, easy to dismiss, and almost never linked to the liver in everyday conversation. So in this video, I'm going to walk you through 9 warning signs that your liver may be struggling, including some that I can almost guarantee you have never connected to your liver before. And if you stay with me until the end, I am going to give you 9 evidence-based habits that protect your liver and your overall health for the long term. Let us get into it. Before we get into the signs, I want to spend just 2 minutes explaining what your liver actually does, because most people genuinely underestimate this organ, and that underestimation is part of why liver disease gets missed so often. Your liver is your body's primary processing center. It filters literally all of the blood coming from your digestive system before it circulates to the rest of your body. Every toxin, every medication, every glass of alcohol, it all passes through your liver first. Your liver also produces bile to help digest fats, regulates blood sugar between meals, manufactures most of the proteins your blood needs to clot, and stores vitamins and minerals, including iron and vitamin D. Here's the remarkable and also the dangerous thing about your liver. It is extraordinarily resilient. It can keep functioning relatively normally even when 30, 40, sometimes 50% of it is damaged, which sounds impressive until you realize what that actually means. It means the damage is happening silently, for years, with almost no outward warning. And by the time function starts to noticeably decline, a significant amount of harm has already been done. The good news, and this is important, is that the liver is also one of the most regenerative organs in the human body. Caught early enough, fatty liver and early fibrosis can genuinely be reversed. That is not true of many organs. That is why identifying these signs early matters so much. It can completely change the outcome. The first sign is fatigue. Now I know, fatigue is on every list of every health condition ever discussed, but I want you to hear me out, because the kind of fatigue associated with liver problems has a specific character to it. It is not the tiredness you feel after a poor night of sleep or a demanding week at work. It is a deep, persistent exhaustion that does not improve with rest. You sleep for 8 hours and wake up feeling as though you barely slept at all. You feel mentally foggy. You feel like your energy has a ceiling that keeps getting lower. This happens because when your liver is not processing waste efficiently, those waste products build up in your bloodstream. Your body is essentially running on a clogged filter. Every system in your body has to work harder, and that costs energy. The clinical term for the extreme version of this is hepatic encephalopathy, but the early stages are far more subtle. If your fatigue is persistent, unexplained, and unresponsive to rest, that is worth taking seriously. The second sign is a dull ache, a feeling of pressure, or a persistent sense of fullness in the upper right side of your abdomen. This is directly beneath your rib cage on the right. Most people feel this and assume it is digestive, indigestion, gas, something they ate. And sometimes it is. But the liver sits exactly in that location. When it becomes inflamed or enlarged, as it does in fatty liver disease, it causes exactly this sensation, a dull, non-sharp discomfort that people tend to ignore or explain away. This is not usually a dramatic pain. It does not stop you in your tracks. It is more of an awareness, a slight heaviness on one side. If that sensation has been there for more than a few weeks and you cannot explain it with something obvious, put it on your list of things to mention to your doctor. The third sign is something that almost no one connects to the liver, and that is weight that accumulates specifically around the middle, even when your diet has not really changed. Here is the link that most people miss. When your liver is not metabolizing fat efficiently, which is precisely what happens in non-alcoholic fatty liver disease, fat storage increases. Your liver is supposed to process incoming dietary fat and regulate how much is distributed to fat tissue. When that system is impaired, fat accumulates. And visceral fat, the fat around your organs, tends to accumulate fastest. This becomes a vicious cycle very quickly. Visceral fat drives inflammation. Inflammation drives insulin resistance. Insulin resistance makes the liver store even more fat, and around it goes. The measurement I always come back to here is your waist circumference. For women, a waist above 80 centimeters is a metabolic risk flag. For men, above 94 centimeters. If that number has been quietly rising year on year, even if your overall weight seems stable, it is worth investigating your liver function. The fourth sign is visible changes to your skin and eyes. Now, the dramatic version of this is jaundice, the yellow coloring of skin and the whites of the eyes that people associate with serious liver disease. But long before that appears, there are subtler skin changes worth knowing about. Spider angiomas are small, spidery red blood vessel clusters visible on the skin, usually on the upper body. Palmar erythema is a reddening of the palms. Persistent itching without an obvious rash, a condition called cholestasis, occurs when bile salts build up in the blood and deposit under the skin. If you have noticed unexplained itching, unusual skin markings, or your eyes occasionally look slightly yellow in certain lighting, do not dismiss those observations. This is the sign I mentioned in the title that most people ignore. It is changes in your digestion and appetite. Specifically, a reduced appetite, feeling full very quickly, or developing a genuine aversion to fatty foods that you previously had no problem eating. Your liver produces bile, which is essential for digesting fats. When liver function declines, bile production becomes less efficient. The result is that fatty meals suddenly feel heavy, uncomfortable, or simply unappealing. Some patients describe this as the food just sitting there and not moving. Others lose their appetite entirely for periods of time. These are not random digestive quirks. They can be early indicators of liver stress. The sixth sign involves changes in your urine or stool color. Your urine should be a pale yellow color when you are well hydrated. If it is consistently dark, a deep amber or tea color, without an obvious cause like severe dehydration, that can indicate bilirubin spilling into the urine. Bilirubin is a waste product processed by the liver. When the liver is struggling, bilirubin can accumulate in the bloodstream and pass into the urine. Similarly, your stools can become pale or clay-colored when bile flow from the liver is obstructed or reduced. Both of these are signs that something in the liver-bile pathway needs investigating. The seventh sign is something most people put down entirely to aging. They start bruising more easily. Small cuts take longer to stop bleeding. They chalk it up to getting older, taking a daily aspirin, or just being more fragile. But here is what is actually happening in many of these cases. Your liver produces the clotting factors your blood needs to stop bleeding efficiently. When liver function declines, clotting factor production declines with it. The result is precisely this pattern: easier bruising and slower wound healing. If you have noticed this trend over the last year or two, it belongs in a conversation with your doctor. The eighth sign is fluid accumulation. This can show up as swollen ankles and feet, what we call peripheral edema, or as abdominal swelling, which is called ascites in its more advanced form. When liver function declines, it produces less albumin, which is the main protein responsible for keeping fluid inside your blood vessels. Without enough albumin, fluid leaks out into surrounding tissue. Gravity pulls it down to your feet and ankles. You may notice sock marks that stay for hours after you take your socks off, or shoes that suddenly feel tight by the end of the day. This symptom appears in other conditions too: heart failure, kidney disease, but it should always be investigated. The ninth and final sign is brain fog and mood changes. When your liver is not filtering waste from your blood effectively, ammonia and other toxins begin to accumulate. Your brain is highly sensitive to these compounds. The early result is exactly the kind of cognitive dulling that people increasingly attribute to aging, stress, or poor sleep. Difficulty concentrating, slower thinking, forgetting words mid-sentence, irritability without clear cause. In more advanced liver disease, this becomes hepatic encephalopathy, a serious condition. But the early cognitive effects are far more subtle and almost universally missed. Now, I promised you the other side of this conversation: the habits linked by research to better liver health and longer, healthier aging. These are not complicated, they are not expensive, but they are consistent, and consistency is everything. Habit 1 is cutting ultra-processed foods. This is the single biggest lever most people can pull. Processed foods high in refined carbohydrates and seed oils are the primary driver of non-alcoholic fatty liver disease in populations that do not drink heavily. Reducing them significantly reduces liver fat accumulation. Habit 2 is walking every day. Not running, not intense exercise, though those help too. Just consistent daily walking of 7,000 to 10,000 steps has been shown in multiple trials to reduce liver fat, lower visceral adiposity, and improve insulin sensitivity. It is one of the most underrated tools in medicine. Habit 3 is controlling your blood sugar. Insulin resistance and fatty liver disease are deeply intertwined. Anything that improves your insulin sensitivity, reducing refined carbohydrates, eating in a shorter window, increasing muscle mass, directly benefits your liver. Habit 4 is moderating or eliminating alcohol. Even moderate, regular alcohol consumption accelerates liver fibrosis, particularly in people who already have fatty liver disease. If your liver is already under metabolic stress, alcohol adds a second layer of insult on top of it. Habit 5 is coffee. This one surprises people. Multiple large studies have found that regular coffee consumption, 2 to 3 cups per day, is associated with significantly lower rates of liver fibrosis, cirrhosis, and liver cancer. The mechanism is not fully understood, but the association is remarkably consistent across populations. Habit 6 is sleep. Poor sleep, and particularly obstructive sleep apnea, is now strongly associated with non-alcoholic fatty liver disease independent of body weight. Getting 7 to 8 hours of quality sleep is not optional for metabolic health. It is foundational. Habit 7 is reducing visceral fat. I know this sounds circular. Excess fat causes fatty liver, so lose fat to protect the liver. But the mechanism matters. Even modest reductions in waist circumference of 5 to 10% have been shown to meaningfully reduce liver fat content. The starting point is your waist, not the scale. Habit 8 is staying hydrated. Your liver needs adequate fluid to process and excrete waste. Chronic mild dehydration impairs metabolic function across multiple organ systems, including the liver. Aim for 1.5 to 2 liters of water daily as a baseline, more in heat or with exercise. Habit 9 is getting your liver function tested. This sounds obvious, but most people have never had a liver function test in their lives. A simple blood panel, including ALT, AST, GGT, and albumin, gives your doctor a window into liver health. If you are over 35 and have not had this checked recently, ask for it at your next appointment. It is simple, it is cheap, and it can catch problems years before they become serious. I want to end with something important. These 9 signs are not a reason to panic. They are reasons to pay attention. They are reasons to have a conversation with your doctor rather than explaining something away for another year. The earlier you catch liver disease, the better the outcome. That is not a platitude. That is a clinical reality. Your liver can regenerate. Early fatty liver disease can be reversed. Early fibrosis can be halted and in many cases reversed. Those are outcomes that are simply not available once significant damage has accumulated. Which means the single most important thing you can do right now is take what you have learned today seriously enough to act on it. If this video helped you, please share it with someone who needs to hear it. Subscribe so you do not miss the next video, where I am going to be covering the blood tests your doctor should be running every year, but probably is not. I will put a link to that video on screen now, and I will see you there.